Today I'll be talking about premature ejaculation or PE. Today we will talk about few things. First, we will start with definition. What is premature ejaculation? What's normal ejaculation? How common is premature ejaculation? How does a urologist diagnose a premature ejaculation? What's treatment for premature ejaculation? Let's see what is normal ejaculation. There are 4 stages of sexual response: desire, arousal, orgasm, and then resolution. Let's talk first about how ejaculation works. There are 3 phases to ejaculation: emission, expulsion, and orgasm. These phases are controlled by signals sent through the brain and spinal cord. When a man has reached a peak sexual excitement level, signals are sent through the sympathetic nervous system. This triggers the first phase of emission. The sperm moves from the testicles up to the prostate. There it mixes with fluid from the seminal vesicles to make semen. Then expulsion occurs when the pelvic muscles contract. This rhythmic contraction forces the semen out of the penis. For most men, erection goes down after this step is called orgasm. Orgasm is the pleasurable result of brain-cerebral processing of the sensory nerve. What is premature ejaculation or PE? Some men believe that they ejaculate too quickly during sexual activity or feel that they do not have much control over how quickly they ejaculate. This situation can lead to personal distress, partner distress, decreased sexual satisfaction, and relationship issues. But when is it technically considered premature ejaculation? Although definitions of PE vary, the International Society for Sexual Medicine, ISSM, defines premature ejaculation as a male sexual dysfunction in which ejaculation always or almost always occurs before or within about 1 minute of penetration. Proceed further with how common is premature ejaculation. In the United States, about 1 out of every 3 men experience premature ejaculation, so this is a common issue. Now the question arises, what is normal intravaginal ejaculation latency time for a man? The normal intravaginal ejaculation latency time is 5.4 minutes, which is considered as normal ejaculation time. And we know that intravaginal ejaculation latency time decreases with age. So, if you have 20 minutes of intravaginal ejaculation latency time, you will be very happy, and then you hit age 50 or 60, you start to see that number decline. You start to last only 5 minutes. That is expected with aging. So that is not pathology necessarily, that is just you getting older. Now, premature ejaculation can be classified into 2 types. First one is primary premature ejaculation or lifelong premature ejaculation. And second one is secondary premature ejaculation or acquired premature ejaculation. Lifelong or primary premature ejaculation occurs all or nearly all of the time beginning with your first sexual encounters, which is less than 1 minute of intercourse. Whereas, acquired or secondary premature ejaculation develops after you've had previous sexual experiences without ejaculatory problems, which is less than 3 minutes of intercourse. What causes premature ejaculation? There are many factors that may contribute to premature ejaculation, including psychological and biological causes. The following is a list of situations and conditions that may play a role in causing premature ejaculation. Things that can impact one's man experience with his premature ejaculation, including sexual abuse, past sexual experiences, depression, anxiety and stress. Low self-esteem or poor body image also responsible for premature ejaculation. Erectile dysfunction, infection or inflammation of the prostate or urethra prostatitis, which is inflammation of the area around the prostate, can lead to premature ejaculation. Thyroid condition like hyperthyroid, weakened pelvic floor muscles as well as a hormonal imbalance can cause premature ejaculation. In terms of lifelong premature ejaculation, we tend to explain this by an imbalance of neurotransmitters in the brain like sensitivity of the serotonin receptor and interaction between serotonin neurotransmitter and spinal cord reflex, as well as metabolic syndrome. So we do see with men who have elevated cholesterol or diabetes or obesity and other factor that can precipitate as premature ejaculation or even erectile dysfunction. Proceed further with complications. Premature ejaculation can cause problems in your personal life, including stress and relationship problems. A common complication of premature ejaculation is relationship stress. Now, let's see the diagnosis of premature ejaculation. Diagnosis is based largely on a patient's self-report of intravaginal ejaculation latency time. Important questions to discuss with urologist are: what your experience? How long you last? What is the time between penetration and ejaculation? Can you delay ejaculation? Do you feel bothered, annoyed, or frustrated? Have you experienced this problem since your first sexual experience on every attempt and with every partner? Is your erection hard enough to penetrate? Do you have difficulty maintaining erection during sex? Do you ever rush intercourse to prevent loss of erection? How upset is your partner with your premature ejaculation? Is it affecting your relationship? Have you received any previous treatment for premature ejaculation? And sometimes blood tests to evaluate possible medical causes. In terms of treatment, let's start with simple stuff, then I'll discuss some of the experimental therapies and maybe natural remedies that you hear about online. In terms of physical fitness, we have multiple studies that have shown that weight loss and improved cardiovascular activity, particularly in a man with metabolic syndrome, can impact and improve premature ejaculation as well as erectile dysfunction. In terms of cardiovascular activity, you have to do it at least 3 times per week for at least 30 minutes at a time. You want to be sweating. You want your heart rate to go up. That means you are having good experience of exercise, which improve your premature ejaculation as well as overall health. Psychosexual therapy or sex therapy. It is a huge component of any kind of premature ejaculation. So, this can include individual counseling or couple counseling. It can help to expand the sexual repertoire and open up discussion. In terms of behavioral therapy, this is different from psychosexual therapy. In this technique, the couple of methods were described in literature 50 or 60 years ago, including start-stop technique. This is where you stimulate the penis until you feel the urge to ejaculate. And then remove the stimulus until the urge subsides for at least 30 seconds. Repeat these 3 to 4 times. There was also squeeze method, which was described by Masters and Johnson in 1970. This is where you take yourself up to the point of almost reaching that threshold. And then you squeeze the glans penis until the urge to ejaculate subside. It is not quite painful or anything. Topical anesthetics, aesthetic creams and sprays that contain a numbing agent, such as benzocaine, lidocaine or prilocaine, are sometimes used to treat premature ejaculation. These products are applied to the penis 10 to 15 minutes before sex to reduce sensation and help delay ejaculation. A lidocaine-prilocaine cream for premature ejaculation is available by prescription. Lidocaine sprays for premature ejaculation are available over the counter. Although topical anesthetic agents are effective and well tolerated, they have potential side effects. For example, some men report temporary loss of sensitivity and decreased sexual pleasure. Sometimes, female partners also have reported these effects. Oral medications. Many medications might delay orgasm. Although none of these drugs are specifically approved by the Food and Drug Administration to treat premature ejaculation, some are used for this purpose, including antidepressants, analgesics and phosphodiesterase 5 inhibitors. These medications might be prescribed for either on-demand or daily use, and might be prescribed alone or in combination with other treatments. Experimental techniques. Alternative medicine. Several alternative medicine treatments have been studied, including homeopathic medicine, Ayurvedic medicine, yoga, meditation and acupuncture. However, more research is needed to evaluate the effectiveness of these therapies. Thank you for watching.